In the tapestry of life, where every thread holds a story, America in Black and White emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening, ladies and gentlemen, and welcome to another episode of America in Black and White. Tonight, we gather at the intersection of truth, justice, and lived experience. America in Black and White has always been a space where we peel back the layers of our nation's most pressing issues, but also where we celebrate the brilliance, resilience, and leadership that continues to move our communities forward. And on this evening, we are joined by a woman whose life work embodies all of that and more. Dr. Nicole Vick is not just a public health leader, she is a force. For 2 decades, she has stood on the front lines of equity, fighting for the health, dignity, and humanity of underserved communities across Southern California. She brings a voice that is unapologetically rooted in the Black womanhood, in social justice, and in the belief that our communities deserve better systems, better outcomes, and better opportunities. From the halls of academia to the neighborhoods of Los Angeles, from the pages of her books to the microphone of her weekly podcast, Dr. Vick has made it her mission to amplify the issues that matter most. And behind her brilliance stands a legacy. Her grandmother, Tommy Simpkins, and her grandfather, Nathan Neal, two pillars whose influence and shaped her purpose, her passion, and her path. Tonight, we honor her story, her work, and her unwavering commitment to the people. This is season 4, episode 30, and this is America in Black and White. And let's welcome Dr. Nicole Vick to the stage. Hello, Dr. Vick.
Hello, hello. How are you?
I am just excellent. How are you this wonderful evening?
I'm doing well, and I'm glad to say I have on the correct.
About you before we delve into the wonderful things that you're doing. So can you tell us, when you look back over your life, what early experiences shaped your passion for public health and community advocacy?
Wow. So I think we've talked before about this. I've been so blessed to have examples of Black history in my own personal life. And I think those are the examples. So I'll share my aunt, for example, my mother's oldest sister was an activist. She was very much a vocal person around people with disabilities. And I saw her at commission meetings. I saw her in photos with the mayor of Los Angeles at the time, which was Mayor Tom Bradley. And I'm like, wow, this woman is being a true public servant, really speaking up for people that can't speak for themselves. So I think that was for sure one of the earliest examples. And then the other one is, well, actually, I'll say two more and then I'll be quiet. The other one was when I saw Latasha Harlins be killed over a bottle of orange juice here in South Los Angeles. I don't know how many people are familiar with that case. This was in the 90s, the early 90s here in South Los Angeles. I think that really stuck with me because she wasn't that much older than I was at the time. And recently I went to the California African American Museum and saw an exhibit of her life and saw one of her school assignments they had put up on the wall, and her teacher had given her an A+, and it really humanized her for me. But I think that was another example of, wow, I want to be of service to other people. The last one I'll share is the 1992 civil riots that happened here in Los Angeles, which were a result of her being killed and the Rodney King beating. seeing those things happen in real time, because I was about in what, eighth grade, so 13, 14 years old. Like, I want to grow up and make a difference in this world. So those were the one person and two incidents that really shaped my journey into public health.
Oh wow. So when you think about that today, what are some of the things that you know that it injected in you that helped to project more of what you're doing now for advocacy work and community health?
You know what? There's this term that we use in public health called the social determinants of health. And really, what it is that healthcare is not the only thing that has a determining factor on your health. Things like housing, educational attainment, jobs, all these sorts of things actually have a greater impact on your health than your access to healthcare. Not to say that access to healthcare is not important, but these things have a huge, huge impact. And so, growing up in South Los Angeles and then wondering how come we have so many liquor stores, but then when I go to Santa Monica, I don't see no liquor stores. When I go to Malibu, I don't see no liquor stores. Um, Again, thinking about the riots in 1992, seeing the entire South Los Angeles being burned down, but no other part of LA got burned down, seeing police brutality. So I literally saw what the social determinants of health are. I saw them in real life, in real time, in my life. And then it's like when I got into grad school and started understanding public health, I'm like, oh, so you talking about we don't have no grocery stores. Oh, yeah, that's like over here. Literally, we just got a grocery store down the street from my house. We lost one, it closed, and we didn't have a store for like 3 years. And we just got a new one just now. So I literally see the things that we talk about in class. When I was in grad school, I was like, yeah, we see that in real life. So I was living it while I was learning it. And I think that's what really drove me into the field.
So growing up, what messages or values were instilled in you that still guide your work today?
Wow. Okay. I was so blessed to have not only my grandparents on my mother and father's side, as I was growing up, but I had my maternal great grandparents, and you mentioned my great grandmother Tommy Simpkins. I just feel like I had a sense of community. I had a sense of family. I had a sense of integrity and honesty. So, another aspect of my life that was really, really important was the elementary school I went to was a parochial school. So, it was a private Lutheran Christian school, and every single teacher in that school was black. Principal was black. The pastor was black. Everybody was black. Okay. We learned about Black history. We learned about ourselves very, very early on. I can remember our fifth grade teacher, Mr. Williams, who just passed not too long ago. He used to make us do the "I Have a Dream" speech, and everybody had to recite these speeches and do all this work. And I think those foundational early experiences really taught me about what it means to be a Black person, a Black woman, and how to be a good person and a good citizen in general. I think all of those experiences and those folks really, I stand on their shoulders, and I think about them actually quite often, because they gave us so much, and I don't think I really understood it at the time. You know what I mean? We never really realize it at the time, but then when you get older, like, that's why this particular teacher said this to me, and now I get it. So really grateful for those experiences.
How does those experiences translate over to your work in the community with the people?
Same thing. It's this idea of, listen, my responsibility is to make sure that the folks that come after me get a hand up, get a leg up. I can give them information that maybe, someone else wouldn't give them. I do not believe in gatekeeping. Right? Like, well, I'm not going to say nothing. They'll have to just figure it out themselves. I don't believe in that. If I know something that is going to help you, I'm going to tell you. I'm going to say, listen, this is what you need to go tell them people to go get this job. This is what you need to say. This is what you don't need to say. I love mentoring. That's why I went into teaching and I taught for so long. I taught from like 2008 to like 2022. And I loved it. I loved inspiring students to understand public health. I loved being that face of public health for them in the classroom, because a lot of them, truth be told, I was sometimes their only experience with a Black person in front of them in the classroom. And the reason why I know that is because I asked them. We would do a section on education as a social determinant of health. And I would say, when did you have your first Black teacher? And without fail, there was at least 2 or 3 of them every semester that would say, you are my first Black teacher. And so I felt honored to be that first Black teacher, because I'm like, listen, you finna hear the academic side, you're going to hear the work experience, and you're going to hear the South Los Angeles part of me all in this classroom, because it all is important and it matters. So I don't even know if I answered your question, but I said
You did, and like I said, this is again, this conversation is more than what I think that the people probably thought they were going to get. I think it's better, and so I appreciate that. And the more elaborative, the better it is. How did your identity as a Black woman influence the way you navigated your educational and professional journey?
wow. So I just saw a post on social media that said, let's bring back shame around teen pregnancy. And I was
My
like,
God.
and I said, no, we're not going to do that. I said, because
Oh,
I'm forever grateful that my family and my church family at the time did not shame me around teen pregnancy, because if they had shamed me, I don't know if I would be where I am. I have 3 degrees, a bachelor's degree, master's degree, and a doctorate degree, and almost 29-year-old daughter who is actually not a teen mom. She did not have a child. She didn't follow in my footsteps, which was a good thing. And I don't think shame would have saved me or helped me. So when you ask me about how my position as a Black woman sort of informed sort of my life trajectory, I really focus on that, because as a Black mother and a Black woman, I had to learn a lot of hard lessons. But one of the reasons why my book is called Pushing Through is because I pushed through every single one of them. I can remember very, very clearly having my daughter 8 weeks early in March of 1997 on a Wednesday. They sent me home from the hospital on Friday. I went to church on Easter Sunday, and I went back to school on Monday. And I did not look back. I did not hesitate. I did not talk myself out of it. Now, 47-year-old Nicole would have talked herself out of that. Like, that don't make no sense. Girl, you better go home and sit down. 18, 19-year-old Nicole said, we just gonna keep going. And and I will say this as well. Speaking again about Black women, womanhood, my mother was the one that said, I got you. Leave her here and go to school, because she understood the value of that education that I was trying to get. I was trying to get my bachelor's degree. I even knew better. I said, well, I got to get done with this thing, because this is the only way I'm going to be able to take care of my family ultimately. So, as a Black woman, I understood the assignment. I knew what it was. I knew what I had to do. And I wasn't going to let what some people would consider a barrier to stop me. And I'm fine. She's fine. She's in Phoenix. She's fine. Everybody's fine. It worked out. We're okay. So I just would lift up that example of an aspect of Black womanhood, that, I had to do what I had to do, and it got done.
right. What was the moment you realized that public health was not just a career, but a calling?
Oh, I don't know. I don't even think I have an answer for that. But it definitely, you are correct. It is not just a career, it's a calling. Everything that I do, everything that I see, everything, even the way I teach, is through that public health, social justice lens. It's like a pair of glasses. And once you see and understand the world in that way, you cannot unsee it. But I can't think of like a moment where it's like, this is it for me. I will say that I have had amazing mentors through my 20 plus years in this work. And all of them have been Black women. I had an epidemiologist tell me, girl, you better go back to school and get your master's degree. And I was like, oh, that's more years of school. I don't want to do that. She said, you will double your salary, do it. And one thing I will tell you is, I have learned that when the not the ancestors, when the elders speak, you listen and you pay attention. And I did what she said, and she was right. She actually still works where I work. We work in the same place. She's still there. And I called her and said, I'm going to get my doctorate degree. She said, go. She said, because that way, if they're going to count you out, it will not be because you're not prepared. A doctorate degree that's top of the line. Another woman I worked with was a supervisor of mine. Same thing. Put me in spaces where above my pay grade, go to this meeting and speak on my behalf. I can't go, you go. And so she showed me and exposed me to so much. So maybe it was through those experiences with them that helped me understand it was a calling and not just a job. But to your point, I definitely feel like this is not just about a job. It's really about a career and a way of living and seeing things and a worldview for me.
Now, I got to follow up to this because, it's so interesting, in hearing you talk about public health. Um, my former work wife, okay, got her graduate degree in public health. I know so many women that actually went the route of public health. And so when she and I started working together, I was learning more and more as to how this applies because there would be some stuff in our work that she'd be like, yeah, about public health. Can you tell me, do you think public health is primarily like something that women are focusing on because it's like it's more than just a community, it's the world?
I think so. I was doing so. My dissertation is public health focused, and I was doing some research and looking into some demographics on the workforce. And yes, predominantly women dominated field. There's some guys there. I see some, even in my workspace, black men. I call them unicorns because we don't see them often, but they are there, very knowledgeable and very skilled, but we don't often see them. So it's like, oh my gosh, hello,
Mhm.
and they're amazing. So definitely very much a woman dominated field. And the awesome thing about public health is almost like in everything. You can connect public health to transportation, housing, built environment, all these sorts of spaces. There are doctors in public health, nurses, dentists, veterinarians, lawyers. There's all kind of folks that work in this space. And I said to myself, wait a minute, let me back up. Just in case folks are listening and are like, what is public health? Public health is the prevention of disease and promotion of health in communities. So we're looking not just at the individual like a doctor would, we're looking at communities, and community could be a
Right.
state. It could be a city. It could be black people. It could be young people. It could be people that speak Spanish, people that watch the Super Bowl. Our communities can be defined in different ways. And we're really working on keeping you from getting sick in the first place. So if we can keep you from getting the flu, we will do that. We will talk to you about a flu vaccine or washing your hands. So that's what public health is in like really quick terms. So yeah, I think it's woman dominated for that reason. And I don't know, it's just an amazing type of work, and you can kind of have any type of education and experience and find your way in public health.
How has your personal story helped you connect with the communities you serve?
Wow. Well, again, as I mentioned earlier, like a lot of the communities that I serve, we all have the same story. We all have the same personal story. We live in underserved communities with low resources. Even though I have a doctorate degree and I make a pretty good income, I chose to live in South Los Angeles in my community. So when people are talking about the fact that there's no grocery store, oh yeah, I know because we didn't have one till 15 minutes ago. We're talking about crime. Yeah, I know. Oh, I live in Compton or Watts. I used to work in Watts. I get it. I used to ride my bicycle through Watts to get to work on, a couple times a week when I worked down that way. So a lot of the stories and examples and things that I've lived through, they understand it as well. Teen pregnancy. Okay. I mean, hello. I was a teen mom. I get it. So I think that thankfully, a lot of my lived experience has informed my work. I currently work focus on people with disabilities. I broke my ankle almost 2 years ago and was disabled in a wheelchair. So even some of that lived experiences has been helpful in my work because I'm like, hey, I can't get into this building because there's no ramp. Why can't we make this better for people? So I think interestingly enough, a lot of the things that I've experienced have actually been very, very helpful to my work, and have led me to be more sensitive and understanding of some of the issues that people go through in their communities.
So, what challenges did you face entering a field where Black women are often underrepresented in leadership roles?
Very true statement because we are underrepresented. Again, I found a research article that talks about that although we dominate the field, very few of us make it into leadership roles. I don't think I've had any personal experiences of challenges, but I will say that one of the things that I focused on in my dissertation was psychological safety, which is really about, can I come to work as my full self? Can I talk the way I talk at home at work? Can I push back against authority? Can I ask questions? Can I make mistakes at work? And for a lot of us who are Black, who are minoritized in some way, one way or another, we are not psychologically safe at work. We can't speak up because if we speak up, we will be punished. You don't get the promotion, right? Or you get the job assignment that nobody else wants, or you're not offered the raise. And in my research, I did find that a lot of the folks that I interviewed had a really hard time. One person was saying, hey, they offered me a raise, but they wanted it off the record. And so I agreed to it. So and it wasn't in writing, but then when it was time to pay, they didn't want to do it. And then she was like, wait, those kinds of things still happen to people, not specifically in my workspace, but the folks that I interviewed from my research talked a lot about that. And what happens is we leave the field earlier. So as valuable as we are to the work, because we're not psychologically safe, because we're experiencing institutional racism in these workspaces, we say, you know what, it's all right, I'm gonna go find something else to do. I'm leaving. And then what happens is you lose that institutional memory, the institutional knowledge, the lived experiences, and all the things that make what we do so important. So there are some very, very real challenges for folks that look like me in this field of work, which is ironic because the work that we do is supposed to be focused on health equity. It's supposed to be focused on inclusion, diversity, all those things. But even still, we still have challenges in that workspace.
How do you maintain your sense of self and purpose in spaces that may not always affirm your identity?
The good thing for me is I have figured out that I have to do other things outside of work to affirm who I am. And so one of them you might have noticed because I've been doing this whole time with my hands. I do my nails. My nails is like a self-care strategy for me. It People say, "Oh, you probably save a lot of money," and it's really not about money saving. It's just a creative outlet for me and a way for me to focus and just kind of be in my own space. Writing, so the books that I have written, another example, and my weekly podcast. So I tell people that come into the kind of work that I do, you will have to find other things to do to make you happy because you will sometimes go to work and do a really good job and work hard, but no one at work will affirm or validate that experience. So you're going to have to figure out other ways to make yourself happy. And so if it's cooking or singing or playing sports, you need to figure that out. But I figured out is nails and going to the pool, and that's it. Just figuring out those ways to make my own self happy.
Well, I'll tell you like this. Just as you think about, just different challenges when you're thinking about diversity, equity, inclusion, and just, having the merits, recognize the merits for the work that you do. I know that that's one of those things that I'm not sure that most of these major corporations are ready to do that. And they try to do that in the most inconspicuous kind of ways to where you got this position, but you need to shut your mouth. Now, I think that, with you saying that might not have happened to you, but those that you may have interviewed that had to be in situations like that, what were their outcomes? How did they really feel about being in those kind of spaces?
One of the things that I heard a lot was frustration, anger. I mean, the one young person that was offered the promotion, but then they kind of, oh, oops, never mind. She was angry, and a lot of frustration and worry. And one of the things that I found in my dissertation was that a lot of Black women specifically will do something called self silence. And we can draw all the way back to slavery and in regards to what self silencing is. And if you think about it, it makes sense. If I'm quiet, hopefully whatever's going on will pass me by. They won't even know I'm here if I keep my mouth closed and just kind of keep my head down and do my work. And so that was something that came up for the participants in my research. They were like, if I'm just going to sit here, I'm going to come to work, I'm going to do my job, I'm going to go home. And I'm not going to say anything. Unfortunately, what happens in a lot of spaces is you already notice by example, you looking around, when this one spoke up, this something bad happened. So I ain't saying nothing. Even if I know, somebody should probably say something because nope. I'm not saying anything because it's a protective mechanism to keep myself safe. I'm just not going to say anything. And a lot of them will say, I'm just going to sit here, do my job, and I'm going home. Don't ask me no questions. I don't know anything. We've also learned how to be, how can I call it? We document everything. Right. So one of the participants said something like, someone might walk, by me and say, girl, how you doing? She said, I will respond to them via email. I'm fine, and send it. We've learned also to protect ourselves in that way, keep documentation of everything. So either we're silent or we're overprotective of our own, information, or both at the same time. So we do a lot of things we've learned in many ways to find ways to protect ourselves in the workspace.
What role has mentorship played in your development as a leader?
Oh, wow. Huge, 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 huge. As I mentioned, that epidemiologist that said, take your behind and go get that master's degree. I'm like, all right. Even though I was like, dang, I got to go back to school. But she was, listen, she wasn't telling no lies because it worked out, and it worked out really well. My other supervisor that I had when I worked directly in South LA, we have an office in South Los Angeles, Black woman. She's a physician. To this day, I talk to her. I haven't worked under her for like over 10 years. I every so often text her, hey, how you doing? She really mentored me, really brought me along, and again, showed me things that were above my pay grade. Like, I want you to do this thing, go to this board office and give this presentation. I need you to attend this particular meeting. And I would say something like, hey, I want to do this fellowship and do this thing. Sure. Where do I sign? And so I've been really, really grateful to have those kinds of mentors at work. And I've also had friends outside of the workspace that may have had higher positions, more experience, that also mentored me, that I was also really, really grateful for. People really did light a path for me in many different ways over the years. And it's been an amazing thing. And I will say, because of that, I feel compelled, right? I don't feel like I should just do it because I want to. I feel compelled to do the same for other people. Like, if I can turn that flashlight on and lead you in the right direction and help you get to where you got to go, I'm going to do it.
I'll tell you that right there. I think is key for so many folk that are under us, because if they don't get the mentoring, get the understanding of what is happening and what the purpose should look like, they're going to be lost. And
Right.
so it's like we need more and more people of doing these things, just like what you're doing in the workspace, because it really does matter. Let's transition over to your leadership in public
Okay.
health.
All right.
You spent 2 decades fighting for equity in Southern California. What inequities have remained most persistent?
Oh, that's the thing about public health work in general. I'll give you a quick story. So, as part of my recovery from this broken ankle, I had to go to physical therapy, and I've been in physical therapy for probably, let's see, that was December 2024. What is that, a year and something? So, I said to myself, dang, the physical therapist actually has the best job in the world because she can see, in this case, it's a woman, she can see someone go from broken ankle, can't walk at all, to walking. Like you can in your day can see someone start one way and end another way. When you work in something like public health, because some of these issues are so pervasive, they're so big, you can work a 20, 30-year career and not see that kind of change. So you can sometimes get yourself a little depressed and a little sad about it because it's like when I started, infant mortality was high. And when I left, infant mortality is still high. So a lot of times you don't see those changes. So it can be really frustrating. But you have to find those little moments of like, yes, we did something, be engaging with the community in a way that they're responsive to what you're trying to teach them or help them to achieve. Those kinds of things can be really helpful. I remember when we worked in South LA, working on stuff around violence prevention. And sometimes it's not about, oh, the statistics are improved, right? But it could be, well, we actually got the community together. They're speaking to each other. We got a coalition of community based organizations together to be thinking about this problem. That can be seen as that's a success because there wasn't anything like that before. So, yeah, it's kind of hard because we don't see like a doctor, oh, you were almost dead and now I've, fixed you and you're fine. We don't get to see it like that immediate sort of gratification. It often takes decades and sometimes we don't see any change at all.
What does true health equity look like from your perspective?
Hey, true health equity is that every single person on this planet has the resources, the information, the opportunity, the chance to live their best life possible. That's it. Remove barriers, just remove them. There ain't no gate, there's no door. Everything is available to everyone that needs it. If you need additional health care, you got it. If you need access to food, it's there. There should never be a space or place in this world where people don't have access to food, to housing, to shelter, to education. So, health equity is really making sure folks have what they need. And that might mean that some populations or communities get more resources than others, right? If it's me, I don't need as much. I got a job, I got health insurance, I'm good. But the person next to me doesn't. Give them more. And that's okay. I'm not upset about that. I don't need it. Right. So equity is about making sure folks have what they need. And some people need more and some people need less. And that's fine.
So, how did your time as chair of the LA City Health Commission shape your understanding of policy and power?
Wow, that was an interesting thing. The health commission was a brand new commission too when I started it. So when I started on the commission, it was new. Like we were walking into a new thing, and so that was interesting in and of itself, right? Hey, do we have funding? Nope. Oh, okay. All right then. What exactly are we supposed to be doing? Not sure, but here's some ideas. Go. Oh, okay. And the interesting thing was, I think I served on that commission for about a year or so, and then I became chair. I chaired it for 2 years, which was really, really cool. It was interesting to see the dynamics, right? City government to me is a little different than maybe county or even state. Sitting in these commission meetings and there's people during public comment. Some of them are awesome. They're asking for more information, they're asking for resources. But then there's some people that I feel like They just want to come in and maybe disrupt. And so that was a really interesting thing. Like, and you, because you're the commissioner, you can't match their energy. You just can't. You have to remain composed. And that was kind of hard. I'm like, but you're yelling at me. And I didn't do that to you. I don't know you. Why are you yelling? So those things were really interesting, but it was an amazing experience. And I'm grateful for my council member who said, hey, I'm going to nominate you for this commission. And I'm grateful for the opportunity to serve and to try to get things done. We put together a city health report. There were some other things that were going on with oil drilling in the city of Los Angeles in certain neighborhoods. And so we were trying to work on some regulations to protect the population from the impact of those drilling sites and things. So it was really interesting, and I met some really cool people. And ultimately, I stepped down. I had some other obligations, and I was like, "All right, let somebody else get yelled at." So like, I don't know what's going on here, but it was still an amazing experience nonetheless.
Wow. So was that experience like you guys like actually being like on a council and you got constituents out in the audience?
Yeah, like we sat in council chambers. Like if you ever are like on the city of Los Angeles, like a city council meeting, and you see those big council, that chamber with the big thing, we were in that room. And I had to sit at the little table and with the microphone, and the audience was out there, and they were on a timer. So public comment was like on a 2 minute timer, I think it was. Like it was a really formal thing, a formal agenda, all that. So it was really an interesting thing for sure.
Wow. What are the biggest misconceptions people have about public health work?
I don't know because I haven't touched on this yet, but we have been under. I'm gonna say it, we've been under attack. You have seen a lot of the things that public health has fought hard for over the years, for decades: HIV funding, HIV resources, the CDC, which we all thought feel like it's the gold standard. Oh my gosh, I would love to work for the CDC. Now it's kind of like, what is the CDC right now? We've seen things look really, really different. And it's really disheartening. I think one of the biggest misconceptions about public health is that, well, I'll say it this way: people don't really know what public health is. I'll just say that. I think a lot of people don't understand it. We have always said that when we are working well, you don't see us, right? We're in the back, we're in the background, back here doing stuff, making stuff happen. And we tend to pop out when something happens. Uh-oh, COVID, here we come, right? Uh-oh, there's a fire, here we come. Uh-oh, there's a food recall, or someone at the restaurant serving food has hepatitis A. This is who, you see us at that point. So I think one of the biggest, I don't know if it's a misconception, but one of the biggest issues is people don't know who we are or what we do, and they don't see us until something go wrong, and then here we come with that, don't do this, drink water, put this on, wear a mask, and people are like, who are you and why are you telling me what to do? So I think we have an image control problem. We need to get our public image a little bit more out there so people can understand the work that we do, because it's valuable work. And unfortunately, we're in a space now where that work is being undermined and undervalued. And I think it'll take decades for us to get back to status quo, even right where we were before all of this started to happen. So it's a really hard time. I have mentored students recently, and usually I'm able to get them jobs. I'm like, hey, go to this website. Hey, they're hiring. And I'm able to do that. I can't do that anymore because there are literally no jobs. Things are really, really bad. And I would say that we need everybody to fight for public health right now, because ultimately, if we do not have a public health system in this country, we're going to be in a bad place.
How did the pandemic reshape your approach to community health and advocacy?
Wow. So the pandemic was wild. Let me just tell you that. Let me just say that. I'm like, wow. Think about it. Okay. So I'm a person who is living through a pandemic, trying to survive a pandemic, right? Just being Nicole. but then I also working in a field that is working directly on the pandemic. So on this, and I was teaching at the time too. So it's like I was doing all this stuff. And I will say that it was really interesting to survive and to work through the pandemic and to see the community's response to the pandemic, because a lot of them were angry. Why are you closing my business? Why are you making us wear masks? It did make me realize what I just said to you a few minutes ago, that I don't think people really understand what public health is and why we're here. Because if they did, I don't think they would be so against what we're trying to help. We're trying, like, I'm trying to keep you alive. Hello. I'm trying to save your life and you're angry at me. I don't understand. So it's crazy. And I will say this. I've watched TV and I see nurses or physicians that work through the pandemic, and they are still traumatized because they were literally on the front lines. But I also will say it almost feels like it never happened, which is so weird to me. I'm like, did everybody forget that a million people almost died, or not almost, a million people did die during this
Yeah.
pandemic, and how serious this was? It's like it so quickly we have forgotten the devastation and the trauma around that pandemic. But it was a really interesting time. It was interesting to see how the community responded. Some folks were like, "Yes, whatever you tell me, I'm gonna put this mask on," and some people were genuinely like, "I'm not doing that. I don't want to do it, and you can't make me." And it was really interesting to see both sides of that in real time.
And I have a follow up question to that because you just said a lot of interesting things there. But I want to apologize to you before I actually say this question because I have to phrase it this way, is why I'm
Oh,
saying this.
okay.
You have, when you have a quack like RFK Jr. over the Health and Human Services Department, this idiot is actually causing more harm to this country and to the world because I don't know what they call that. I don't know what they call that. But when you think about all of these things that are happening now, like all of these outbreaks, like measles and mumps and rubella, and you got syphilis and a new variation now of gonorrhea, and you got all of these things that can't be treated the normal way for when I grew up. And now this is like something else. I don't know what that is out there. But you being in public health and with them stripping funds and defunding most of what you guys do, can you tell us how is it that you guys are able to maintain and function, and how do you try to keep it together with things like this happening?
Well, the reality is we're not going to be able to. So you take funding away, how are we paying for staff? How are we paying for anything, right? I think what I also will say is that what many people don't understand is that some of our public health institutions, right? I'm speaking generally, state, local, federal, are funded by taxpayer dollars, and or grants and things of that nature. So if that money goes away, there's nothing necessarily to replace it. This is not run like a corporation. This is not like Pepsi or Coca-Cola, right? Where they can charge for a can of soda and they can use that revenue to pay for things. A lot of our entities are not paid for in that way. And so when your administration shifts in focus and doesn't understand the value, or understands it and does and wants to undermine it, it can cause a huge harm to the infrastructure, the public health infrastructure in this country. And like I was saying, what happens is once you damage it so much, it's not like, oh, we damaged it, and then, well, when it shifts back in 3 years and everybody likes public health again, you just flip the switch and we're back. Like, it takes time, it takes years to kind of ramp back to where we were before it happened. So we can't even improve. We got to try to get back to where we were before we can go up. And so it's really harmful. And I think that we're in a space now, like you said, measles are up and children are actually dying. So
Yeah.
we're actually seeing it's not just, oh, people just talking, oh, you just don't like it because he said this. No, people are dying. And that's the thing that's really, really important. Another thing I'll say that I shared with someone else I was talking to about this before. A lot of people have this thought, well, I have health insurance, I'll be fine. I have health insurance, I'll be fine. It will not matter if the healthcare system cannot support, if everybody's sick, if everybody's sick and we all show up to the hospital at the same time, there are not enough beds. There's not one bed for every person, right? There's calculations to determine how many hospital beds there are for a given population. There's a certain number of primary care physicians, certain number. So even if you have health insurance, that may not save you, because if everybody's at the doctor at the same time, somebody's going to have to wait, right? Or someone's not going to be able to get seen at all. So again, it's really important that our public health systems work and that they're funded correctly. We weren't funded well in the beginning. We were already short staffed overall across the country. So we were already at a deficit. We were already underfunded. And then you're further. So if I only had $5 and now you done took three, I still I still ain't got but two, but at five wasn't enough, right? So we have to make sure our systems are supported. And I think this is a really scary time because we're seeing in real time some of the things that we again worked really hard to get these numbers down, to eliminate, to reduce. We're starting to see those numbers go back up, and that's a bad thing because some people, I say this too, some people that are here today will not be here this time next year because
Exactly.
our public health system is failing. Our healthcare system has been failing, but it's actually doing really bad as well. So I don't know. I need folks to be really mindful and pay attention to what's going on. That's why voting is important. Advocating is really, really, really important.
With them taking away diversity, equity, and inclusion, but the hires that are in Washington D.C. are DEI hires because none of them are qualified. So, with that being said, and based on the calculations for what I've seen and how I did, and I want you to help me out to make sure that at least I'm close, is that for what's happened in a little bit over a year and a month, we've been set back, I say, 2 decades,
Yeah.
especially from the public health perspective. What do you say about that?
I've actually heard four
Okay,
decades.
you've heard four.
I've
Okay.
heard four. I can't remember where I heard that, but I was like, wow. Somebody said about 40, it'll take about 40 years for us to get back to where we were before all of this happened.
Mhm.
And that's huge. That's
That
huge.
is very,
Um,
very huge.
you know, I think so. Here's another train of thought too that I've had about all of this. I've talked to other folks that work in public health as well. We have these conversations all the time. I said, well, you can lament, right? Oh my gosh, public health is being undermined. Oh, but then you could say, but wait, maybe this is the time, this is the opportunity to rebuild this system the way it should have been built. We have an opportunity here, hopefully, to get this right. All of our systems in this country are built on a system of white supremacy, including public health, including healthcare, housing, all of them. So, by it being disbanded, dismantled, maybe now this is the time to bring it to be what it is actually intended to be so that it operates the way it should. Maybe this
Well,
is the time.
this is the last thing I'll say about that because I mean what you're saying is so important though. And see, this is what I'm hoping that the audience is getting is that with I'm thinking 2 decades, you saying 4 decades. If it's 4 decades, then God bless me to get to be 100, because that means then I have to be 100 years old. So I don't know how that's gonna work. But just in this whole systemic thing, this is my thought process, and I've actually said this and I say it out loud a whole lot. This is the opportunity for people in our communities, especially those that are in underserved communities where most of us have come from. This is the time for us to create a system within the system, flourish, Make it change because of what we're going to be doing, and the rest is history because we've always been what was supposed to be anyway. That's
Yeah.
the way I see this happening, and that's the only way that we'll actually survive.
100% agree. 100%. And so here's the sort of an adding on to what you just said. I also think that we need to go back. Our ancestors knew what they were doing.
Yep.
Where did midwives come from, right?
Okay.
Those were our aunties and our grandmas delivering babies. And now here in 2026, we're understanding that midwives are important, especially for Black women as they deliver their babies, right? Yes, go to the hospital if that's what you want to do, but you need a midwife with you to advocate for you and to help you because our maternal mortality rate is really high, right?
Yep.
So we need to go get the playbook, W.E.B. Du Bois, all the great thinkers of the time, male and female, men and women who knew and had the knowledge. We need to go back to that and think about what they were doing. And how they were doing it. And we need to think about that mutual aid. Oh, well, not relying on other people to help us. We can help ourselves, right? Take care of ourselves. Think about the school lunch program that Black Panthers started. Like those were things that we had created, and were successful. We need to think about how we can go back to what they taught us. The book, the recipes are there. They're there. We don't have to recreate anything. They're all there, and use those skills and those knowledges, that knowledge base that they had to build something for ourselves. I agree.
So, what systemic barriers continue to harm underserved communities the most?
Well, Well, I will say poverty is the greatest predictor of poor health. So poverty is one of them. Racism is another one. Racism, I don't know if you remember, maybe 2019, 2020 or so, lots of jurisdictions were saying racism is a public health issue and we need to do something about it. And so, yes, racism is an issue. And when I say racism, I'm not talking about I don't like you because you are. I'm talking about structural racism, institutional racism, those things that really have a huge impact on our health outcomes and our ability to survive and thrive in this country. So, poverty, racism, lack of employment. So, those social determinants of health that I talk about, those are the barriers that keep us from living our best life. Housing, being able to afford your house, being able to afford your apartment, and not have to spend over 30% of your income on your housing so that you can afford other things like food, medication, education, if you so desire. So there's so many barriers that keep us back that we have to address.
So, how do you approach the challenge of making institutions accountable to the people they serve?
It's really hard. It's really hard. Remember, I just said these institutions are not built for us. They were not designed with us in mind. So, accountable to who is the question? That's the first question. Accountable to who? And then, so, it can be really hard. I think a lot of institutions now are starting to rally around and understand concepts like equity, health equity, racial equity, and hey, we have to do things differently, but it can be hard. It's like trying to take a giant, like the biggest ship in the sea, and trying to force it to turn left, a hard left. It's not going to be able to do it. It's going to take a long time, right? So I think that accountability is one of those things that also we need to figure out ways to improve because it's important. There are people in the community that deserve the best that these institutions can offer, and sometimes they do fall short. I mean, it's the truth, right? They fall short. Maybe, oh, well, how come this service is here, but it's only Monday through Friday from 8 to 5? I work. How am I going to get to this service? How am I going to participate? Why are the requirements so restrictive? How come it's not accessible to people that don't speak English? How come I can't get in here and it's not accessible to people with disabilities? Like there's all these things sometimes that cause very real barriers for people that need the resources the most, and there's sometimes no accountability for that.
What innovations or strategies have you seen that give you hope for the future of public health?
Hmm. I haven't seen any personally, but I have been on LinkedIn a lot, and I see a lot of my very, very smart colleagues talk about AI, artificial intelligence in public health, trying to figure out how to integrate. I'll give you another example too. Even our data, how we collect our data, I think we need to learn how to, and some folks are doing, disaggregating our data so that we can understand a lot better what we're seeing in our communities. And disaggregate simply means, so instead of saying black, for example, it's, are they Black American? Are they Nigerian? Like, we're digging down, or as opposed to just Asian, are we looking at Vietnamese? Because sometimes when we just sort of look at one category, we are missing some of the nuance in between populations. So disaggregating data is really important. But I'm also really interested to see how, again, how artificial intelligence can be used in public health. And I know there's some controversy around sort of the resources that AI uses, water and other things, which can be harmful to communities. So we got to also, figure out how to deal with that too. And that's a public health issue, right? If you're
Yes,
taking
it
water from
is.
people's communities and they don't have access to it, that's a huge public health issue. So use of AI to improve public health, I see people working towards, but we got to still figure out how to address some of the environmental harms that come with it as well.
So, how do you ensure that community voices remain centered in decision-making processes?
Simple. You got to ask. You got to talk to. You got to talk to the people. You can't be making decisions about people's lives, and you ain't talking to the people that are going to be impacted. You can't. That's like public health 101. That's the first day of grad school. You have to talk to the community. Now, to be fair, um, you have to figure out how to present the issues to the community, because again, they are the experts because they are living it. But sometimes, the way to get to the solution, you may have to figure out how to give them the right question to get the right answer. So I will say that too. But we have to see them as true partners, not just we know everything and we're going to come over to this community and try to tell them or ask them in the sense of, well, we know better than you, but we're just going to ask you anyway, but we really know the answer. That doesn't work. I'll give you an example. When I worked in South Los Angeles, I remember we were going to a small community group. I forgot if I think it was specifically around nutrition or something like that. And we were going to ask them what they needed. And I had created all this, data and stuff. And I was like, well, diabetes, obesity, blah, 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 blah. I had all this stuff prepared. And we go into the space and we ask them what they need. And then people said, can you get these stray dogs out of our community? They chase after the kids and they're stressing us out. We need you to get the stray dogs out of here. But that's what they needed. That's what they needed. Now,
Are
once we do that, then we can talk about nutrition. But until then, I can't walk to the store to get food. And I sure not gonna send my kids outside with these stray dogs out here and they running around biting people and being, dogs can be really scary. So that was a huge lesson for me. Don't go in and assume anything. You don't know what they're going to tell you. They are the ones that are living there. You don't live there.
right,
Huge
right.
lesson.
Hold on, I'm sorry, but that probably I probably would have asked if they were being serious because that would have caught me off guard.
They were being dead serious. And they were in monolingual Spanish speakers, and they were like, "Get these dogs out of here." That's what they were getting. Yes.
What advice would you give to young Black professionals entering the public health field?
First of all, right now, you got to know that the industry right now, we in shambles a little bit, just a little bit. We gonna be okay overall, but so if you decide, oh, I want to go into public health, just be mindful right now that if you go into school for public health, that will always be a valuable degree, always, right? Always, always. But just know that on the other side of it, right now, it might not be no jobs, and that's real. There's some very real things that are happening across the industry that are very very scary for a lot of people that work in that and do that line of work. So if it means maybe taking a detour temporarily and thinking about other things, I know some people are going into nursing because you always want when will nurses not ever be needed, right? Or into the medical field, or if you go into public health as a career choice, maybe taking a fellowship or some sort of internship or something else in the meantime until things sort of get better. But right now, it's actually scary, and I feel very much like bad for the young folks that are excited about the field, but now they come out and there's nothing. There's really not a lot of opportunity right now for them. So just take that with a grain of salt. If you're interested in public health, I would, I don't ever want to discourage anyone because we're going to need the minds and the bodies to help us figure out some of these problems in the future. But I think right now it's kind of a little bit of a scary space.
So let's transition over to your organizational change in leadership. As a USC trained organized change expert, how do you help institutions confront their own inequities?
Wow. And that's hard because, a lot of times, a lot of times they don't want to see it, right? They hire you to like, hey, I need this help. And then there's that pushback. I think, but one of the things that makes the biggest difference is making sure there's buy-in from leadership. I even say that about people that have DEI roles. If your DEI role does not report to the executive director, you don't have, like, why are you here? So same is true with that kind of work. If there's not buy-in or you're not talking directly to the people that can make decisions, then you're not going to see any shifting or changing in that organization. So that buy-in is really, really important in order to make sure that we're looking at the organization in a way that is sort of, you know, unbiased and balanced. Like, okay, here's what's happening in your organization, and here's what's not. Yeah.
So, what does effective leadership look like in environments resistant to change?
Wow. Have to be transparent, have to be transparent, have to be psychologically safe, have to be able to own up to your own mistakes and be sort of, I don't want to say allow people to just to make willy-nilly mistakes, but you have to be a little bit understanding of people that make mistakes, because part of making mistakes is learning and is innovation, right? You got to try something first. Oh, it doesn't work, we made oopsie. But in that oopsie is where growth occurs. So that leader has to be open to that, and really open to making sure that their workers and their employees are psychologically safe, that they can bring their full selves to work, that they can challenge authority. Because that can be, some people can, hey, wait a minute, this is my company, this ain't yours. No, no, no. Allow for that, because again, sometimes that's where growth and change happens. Like, you know what? You're absolutely right. Let's do it that way. My bad. We've been doing it this way for 10 years, but you're right. We should probably think about doing it different. Let's try it. But you got to be open to that. If you're not open to that, your organization is not going to change. It's not going to grow.
Um, how do you navigate the tension between data driven decisions and community driven needs?
A lot of times what happens is folks don't understand the data. So helping them understand where that data comes from is really important. And I also think that people sometimes, well, that didn't happen to me, that's not how I experienced it, so therefore this data is wrong. But we have to have people understand how important data is, and how important lived experiences is. So you kind of have to help them balance that out, and hopefully you can meet in the middle. I don't think there's a, well, the data says this, so we have to do this. I don't think there's ever a situation where the data is the be all end all. It's sort of an additional tool along with folks' lived experience. Okay, well, the data does say this, and we understand that what you're saying is different. Well, how about we think about this instead? So helping people meet in the middle, is really important.
What strategies have you found most effective in shifting organizational culture?
Like I said, a culture of transparency, gotta be culture of openness. I've also heard and seen that in some instances, employee resource groups, ERGs, are really helpful, where folks can sort of self-identify. Oh, I want to go to the Black ERG group. I want to go to the LGBTQ one, where you can sit with your peers and sort of talk and share and network. Those things are also effective, in helping organizations grow.
How do you measure progress when change is slow or incremental?
Got to think about those smaller benchmarks in between, right? So again, save the world. You're not going to see that, but you can see the incremental changes in between. And sometimes, as I said earlier, it's not about the metrics. It's about, well, hey, we were actually able to collaborate and create a collaborative or some sort of uh, a body of people that came together to create a thing or to work on a thing. Sometimes that's a success in and of itself, that we were able to engage 50 organizations around this particular issue, cross sector around an issue, and now we're moving forward on it. That can be seen as success, as opposed to, oh, we didn't actually move the needle on a specific disease outcome, but we were actually able to coordinate and get the ball rolling on a thing. That can be also seen as success. So you got to rethink how you look at measure success. Sometimes it's about the work that happens and not necessarily the change in health outcomes. That's the success.
So let's move over to your author and storytelling work.
Sure.
What inspired you to become an author, and what stories did you feel compelled to tell?
Sure. So I wrote my first book. Think I just turned 40. And for some reason, I felt like 40 was a good age to stop and look back. Like, how did I become the person that I am in this moment? And I think things happen sometimes and they're not accidents. They happen, on purpose. They're aligned and sort of supposed to happen. And I had gone to a writing course. Little sort of workshop, and there was a woman there that would help people write their first book. And so I was like, oh my gosh. And I won a free session to work with her and ended up hiring her to help me write that book. And that's where my first book came from. And ever since then, I put out this. So that was the first one. I put out a journal, and then I contributed to an anthology that focuses on Black professionals at work, helping them navigate the workspace. I've written articles for I can't remember the name of it. I think it's called Authority Magazine, around specific issues around health, public health, social justice. So I just, hey, we just gonna put it out there and speak on what I know. I mean, I think that's the most important thing, that anybody considering to be an author is speak on what you know, and use that to help engage and inform other people.
So, how does writing allow you to express aspects of your work that policy and data cannot?
Well, I mean, I am one of those folks that really think that lived experience is, I mean, so very important. And so it helps to, so if the data is telling you the what, the qualitative or the story is telling you the why, right? So me telling my story by writing is explaining why some of these things happen. And I think that's what my first book did really well. Like, hey, I started to see these things very early on in my life. The grocery stores closed, we got all these liquor stores. And so, you can access the data about those types of things and count them. But my story tells the why and the how and the lived experience. That's really important. So to me, it's sort of a addition to, it complements the data, and the other things that we see, that the experts, they go back there with the calculators and do the thing. I can really tell you what that looks like in real time.
So, what themes do you hope readers carry with them after engaging with your book?
I hope that they come away with the understanding that you can do anything you want and that you have more power than you realize. I talk about this, I call it immediate power. There's probably a different term for it. But you can make more impact than you actually realize. Hey, you see something happening, you can fix it in your own way. I remember wanting to really focus on Black women business owners. And I had seen a fellow Black woman who owns a business. She would do these really cool pop-up shops. Like, she would rent out space at this big park and invite all the vendors and do all these things. And I'm like, I want to do that. And one of my friends, like, she was like, you can do that. And I was like, huh? She's like, yeah. And I was like, oh. And so I cleaned up my backyard, charge them like $50, bring their stuff. I would send out invitations. I did my own pop-up shops in the backyard for like 3 years. So again, that's an example of like I don't have to wait for permission. I don't have to wait for someone to tell me to do something. I can just do it. And if you pay attention, you can see things like that happen all the time. I don't know if you heard of Miss, I think her name is Miss Shirley. She just recently passed away, but she was really big on literally going out to the community in Skid Row, helping people who were unhoused, who were homeless, with resources, all sorts of things to make people's lives better. I don't think she waited for somebody to tell her to do it. She felt compelled to do it and she did it, and she made an impact because when she passed away it was you could all across social media people were like, I can't believe it. They were so devastated. She had left an impact by doing what she felt compelled to do.
How has storytelling helped you reclaim narratives about Black communities?
It's I think it's the most important thing that we have. I really do. Telling stories. Again, data is important, not to discount it, but sometimes these stories really fill in the gaps. I think about the stories of my great grandparents and their parents. I have access to my great grandfather's slave narrative. That is storytelling. Um, and what data point would explain his experiences to me? There is none, right? The story is the story. It is what it gives that those missing parts, and helps you to understand what's really going on. So I think storytelling is important. If you understand something like critical race theory, there's a concept counter storytelling. I'm going to tell you what's really happening. This is the narrative. I'm going to tell you what's really going on. So storytelling is very, very important, especially for Black folk. Because remember, we couldn't read, we wasn't allowed to. So all we had were our stories to pass down to each other. So I think that's still a very valuable part of our experience.
Um, what has been the most rewarding response you've received from your writing?
I think people, when people tell me they feel seen, I had done a presentation about my dissertation, which is something I wrote, of course, right? And the immediate response is, "Thank you so much. I feel seen." Because no one, I don't think anybody was asking Black people that worked in public health about their experiences. And so when I shared, and they were like, "Yep, yep, yep, I feel seen." I'm like, see. So I think that's probably the most rewarding. Like, wow, you actually see us. Like, of course I do. I'm same. I'm one of you.
Let me ask you this because, I think when we have innovatives like yourself and creatives like you that are around this country, and there's so many of us, what are some suggestions that you would have that we should be able to get together to create some kind of guild or center of excellency of some sort? What are some ideas you think that we should actually be looking at, to add to our stories and the things that we do or have done?
I like that idea, actually. That's a really cool idea. Speakers Bureau or Writers Guild or sort of a think tank kind of thing. I think that's actually really cool. I would also say figuring out a way to sort of coordinate mentoring. We talked about that earlier, where we can really connect people to folks that need us, that need our expertise. And unto under, they may be interested in something and we can connect them. And oh, well, here I know Charles could talk to you about podcasting. He does his da 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 da. And oh, well, you want to do public health or you're interested in healthcare? Well, talk to Nicole. She does public health work. She can help you. Some way to coordinate that on a bigger scale, I think would be really awesome as well.
Um, let me ask you about your work here in community engagement. Can you tell us what does authentic community engagement look like to you?
Simply being yourself. Sometimes we feel like we have to put on airs to go talk to people. And it's like, no, you don't. You got to be yourself, and be honest and transparent. I've said transparency about 500 times today, but it's true. Right. And I think also, um, again, don't go up in there acting like you know everything because you do not. Those folks are living it. You don't know it. You don't live there. Now, if you live there, okay, you can have that different a different kind of conversation. But if you don't live there, you do not know more than them folks. You do not know more than their experience, and their experience will always will trump, anything that you think you know about what's happening to them folks in that community. I think those are some very important concepts. Like, please don't go up in there like, well, the data says. You can talk about the data, but you have to also feel like, hey, I'm actually coming here to learn from you. You are the ones that are living here. um, I think those are some important concepts around engaging community that are important.
How do you build trust in communities that have been historically ignored or harmed by institutions?
That's hard. That's a hard one. Because, and I'll tell you, one of my participants had a really good concept, thought process around this. She said, I feel squeezed like a sandwich. She said, I'm in this governmental space. I have the professional public health hat on, but I've also in the past worked with community organizations. And I'm trying to do this work, and I'm getting pushback from my supervisors. You're doing too much, but then I'm getting pushback from the community. You're not doing enough. And so you're kind of stuck in this weird space trying to navigate, right? And meanwhile, the community is used to, oh, they always let us down. They don't do enough for us. And so there's all these sort of barriers you have to work through, specifically if you are a Black person in public health, or you are a minoritized person working in these spaces. And I would argue not even just public health, any other social service organization, you are faced with that idea of kind of being squeezed. You want to do what you know to be right and true. You may get pushback from your supervisors, and then the people outside are like, you ain't doing enough. You need to be doing more, but you can't, because they're telling you you can't. You can't do that. And so you feel kind of stuck in the middle there, trying to figure it out.
Let's talk a little bit about your podcasting and your media influence. What motivated you to start your weekly podcast?
So it first started with me and my daughter. I wanted to talk to her. I wanted her perspective to be placed front and center. She is a old Gen Z, young millennial, right? So she has to me, a very unique perspective about a lot of things, and I feel like somebody need to hear what she's talking about. So it started with her and I just having conversation about various topics, and then of course after a while, I think she kind of, she's young, so she wanted to do other things and stuff, and that was fine. So then it just really became me going on. I think at the time I was only going on a couple times a month. And then the producer I work with was like, we got to get to weekly. This is the only way you're going to get, the viewership that you want. And so we evolved, and now it's called Dr. Victorious. We have a whole new sort of agenda, the way our show is organized and run. It's really exciting. So I'm excited about it. I've been doing it now, 3 years. I don't even know.
But that's excellent. So, I mean, with that, I mean, apparently, with you going with, the process of how you're handling it. I mean, like, what is the theme of the show? What does the show represent?
It is really about the Black experience, of course, from the public health, social justice perspective that I have. Because I am in South Los Angeles, you can throw that over it as well, like that South Los Angeles experience. And I talk about any number of topics. Sometimes it's health, sometimes it's public health, sometimes it's violence prevention. It could be any number of things, but it's always from that perspective of, I'm a Black woman with this specific lived experience, and I want to bring something to you to educate and inform you.
Wow. Okay. Um, how do you choose the topics you discuss, especially those impacting the Black community?
Sometimes it's something I see in the media, social media. I'm like, I want to talk about that. And sometimes, this is Black History Month. Well, then that means the episodes are going to be about Black history. Um, for example, it's March now, so it's Black Women's History Month as far as I'm concerned. I know it's technically Women's History Month, but it's Black Women's History Month to me. So that's what we're gonna talk about. Um,
See, and of course, I got my reminder well, actually on Sunday, I got my reminder. It's Women's History Month. I remember.
See, see, see.
As a matter of fact, I said, yeah, look, make sure you watch Tuesday. I have a lady on that's going to be talking. Um, what conversations have resonated most deeply with your listeners?
You know, usually the ones that come from the heart. And I know that sounds very vague. I often have people on that are very real. There was one woman I had on. Her name is Vonda Page. Vonda is real. I can't think of the name of her organization, but she talked a lot about institutional racism. She's talking about DEI. I think she actually hates DEI, not for the reasons that you would think. She's not anti woke or anything, but she was like, it's all a facade, right? It's all performative. They do it because it sounds good. The minute things change, they take it away. And she actually was right, because that's what happened, right? A lot of the institutions, when the Department of Education said, I'm gonna start suing these schools if they don't take away this DEI stuff, what did those schools do? They took away all the DEI stuff. And then when the lawsuit went through and they were like, oh, you actually can't do that, everybody was like, see, these schools were quick to try to backtrack so easily. It's really interesting. So I think her episode, I sometimes rerun it just because I'm like, she was talking a lot of goodness. There's another person I had as a guest recently. Her name is Tammy Triolo, and she wrote a book about empathy. And the fact that a lot of what we see now is because people do not have empathy. They don't understand other people's experiences and they don't care to, is why we're seeing some of the discord that we see today. So those two, I think, were really strong episodes.
Let's move over to what we had when we talked. I told you we do Black History 365, and I
Mhm.
asked you who were the most influential persons or people in your life and career. You mentioned your great grandmother, Tommy Simpkins,
Mhm.
and your grandfather, Nathan Neal.
Mhm.
Can you tell us, your grandmother, Tommy Simpkins, she played a major role in shaping your life. What lessons did she teach you?
Wow. So she was, awesome. Now I'm gonna say this: I've learned since then that she was actually really mean, but she wasn't mean to me. So that's all I'm gonna say. She wasn't mean to me. She. I used to love playing in her clothes. And so fashion, I think, came out of that. And she was a cosmetologist. She had her own beauty salon on historic South Central Avenue here in Los Angeles. You hear the name South Central Los Angeles, that's where it comes from South Central Avenue. Dunbar Hotel is on South Central Avenue. So she was an entrepreneur. I feel like, we talk about black women, oh, we're hyper independent. I'm like, but I think we always have been. I mean, she had her own beauty salon. She was married, yes, but she had her own salon and had made her own money. So I don't think any of that is new for us as black women. And so I think she taught me about those things, right? Like, dang, you can take care of yourself. You can go far. You can do what you want to do. She was the one. I can't remember how old I was, but I remember her saying to me, are you going to go to college when you grow up? And I was like, yes, because you're supposed to say yes to your great grandmama. And she said, good, because you'll be Dr. Vick. She's the first one that's called me Dr. Vick,
Oh,
all those years ago. So for her, I'm sure I'm a dream realized, right? Her parents were enslaved. Her father, I mentioned I have his slave narrative. He was born in 1856. He was enslaved. He was property. Her dad, and so I think about that a lot in my life. Like, dang, thinking about sort of where her family came from and the trajectory of her life, a beauty shop owner and all these things that she did, definitely had a huge impact on me.
what qualities did your grandfather, Nathan Neal, embody that continue to influence your leadership?
Oh wow, he was cool because he took, I remember him having to pick me up from school. I was always in his space. I remember I used to spend the night over my grandparents' house. I don't think I used to hang out with my grandma a little bit, but I'd be all, what he's doing. He would teach me things. He taught me Gesundheit, like they say bless you. I forgot what language that is, but he taught me that. He taught me like the capital of, is it Iceland? I can't remember which country, Ricky Vick. Like he was teach me all these little things. He was a firefighter for a very long time, well before I was born. I think he retired the year I was born. And I think I told you when we talked earlier that I went into the African American Firefighters Museum here in Los Angeles one day. And I think my grandfather had already passed away by then. And I walked in there and I'm like, hey, big old giant photograph. And I'm like, that's my grandfather in the museum on the first floor. Like, what's going on? And the guy was like, oh yeah, oh yeah, he integrated the fire station at the LA International Airport. And I was like,
Wow.
I I lived with my grandfather a very long time. Nobody ever told, never, no one ever said that to me. I found that out after the fact by walking into that museum. So, I mean, think about that legacy of service, and also think about how much discrimination he faced integrating a fire station where nobody didn't want him there.
Mhm.
And the amount of trauma and harm that was caused. So, um, just that resiliency too, I think, is definitely inherited.
Their stories connect to the broader tapestry of Black history.
Wow. I mean, so the crazy thing about it is my great grandmother, her husband, who's my great grandfather, he's not my biological great grandfather, but I mean, he's my great grandfather. They owned a Shell gas station in South Los Angeles, South Central Los Angeles. And they hired my grandfather, who, of course, at the time was not my grandfather. He was the guy they hired. And I guess my grandmother saw him and was like, ooh, and they got married. And so that's how, the whole thing was set up that way. And then they had my mom and my aunt, and then here I come. So I guess that's the way the stories, their two stories connected. He has a very interesting background. He was born in New Mexico, and somehow ended up in Los Angeles. And his biological mother, I guess, stayed in New Mexico. I'm not sure, but there was a woman that raised him, and he was so attached and sort of, um, you know, what's the word? That was his mom. That he took her name. So his last name is actually not Neil. Her last name is Neil, but he took her name because I guess he really felt like this woman took care of me. So that was an interesting little tidbit about my grandfather. But I feel like, that generation, if you've ever read The Warmth of Other Suns, um, definitely when I read that book, I'm like, wow, I felt like I was really living the life of my grandparents and my great grandparents because it was around the same time period. I feel like they were a different kind of folk, different level of strength and resilience. Think about what was happening during the times that they were living. And they managed to survive it. And therefore, I'm here because of them.
What does it mean to you to carry their legacy into your work?
It means everything. It means everything, absolutely everything. I am fully aware of whose shoulders I stand on. And I'm trying my best to make sure my daughter knows the same, right? She's very much, she's young. Well, she ain't that young. She about to be 29, so she ain't that young no more. But I just want to make sure she understands it too. Like things that they did make it possible for us to be here. My great grandfather was smart enough. He was a realtor and had properties and things. He was smart enough to put my name and my brother's name on and my mom's name on some properties. And so when we had to sell them, we were able to do some things with that funding, and I bought my house and have other properties that I can hopefully leave to her. So their legacy is not just about the work; it's about material things that they were smart enough to leave behind, for us, so that we could be okay. My brother has property and stuff, so we've been able to do really well based on some things that they had the foresight. They didn't know we were coming. Back at the time that they were putting some of this stuff together. So I think it's really important.
So, how do you honor their influence in your daily life and professional mission?
I mean, honestly, I think everything. that I do is really an honor for them. You know, like I said, she was like, Dr. Vick, you'll be Dr. Vick. And I'm like, okay, now I got to go be Dr. Vick because she said it. She said it. She called it. I have to fulfill that mission. Um, I just feel like everything that I do is really about them, and maybe not so much of them, maybe 30% them, 70% my child, because I think I'm really at this point in my life where I want to make sure she's good after I'm gone. She, even though she swears I'll live forever, I'm like, girl, no, I don't want to do that. No. I don't want to do that. So let me make sure you good. So when I'm going, you're okay. But I just really have a full awareness of the sacrifice and the legacy that they left behind.
Final question. What wisdom from your grandparents do you wish more young people could hear today?
Wow. You know, I don't even know if they even said anything. It was just the experiences. And so maybe that's what it is more so than anything. Because, you know, sometimes your parents or your grandparents say stuff and you're like, well, y'all old, y'all don't know, y'all don't know. So it's not even so much what they say, to me at least. It's about the experiences. I remember going to my grandparents' house. They had a baby grand piano. So I got taught how to, you know, play piano. I had piano lessons. They had world book encyclopedias. I remember, and them things was old at the time, but I used to read them all front to back all the time. Just like, wow. Always interested in learning, always interested in being exposed to what they had. They had all the Ebony magazines, all the Jet magazines. I was fully immersed in what was there. So I would say and I don't even know if it was intentional for them. They just had all the stuff, and I was all in their books and their magazines. I was all on the piano. I had access to my grandfather's pictures from World War II. So I'm like, I'm just was really, really immersed. So I would say it was the experiences, even just being around them. More so than anything else. My great grandfather was like, here, I'm gonna sit you down and show you how to write a check. And so he taught me he had all these old checkbooks, and I'm like, okay, little things like that to me actually mean a lot because it was really about the experiences versus anything that they necessarily said to me.
Wow. So, in closing, what are some words of wisdom and encouragement you'd like to leave for our audience? Tell them how to connect with you via your social media. Tell them about your website, how to get your book, all of those good things.
Word of advice, I think authenticity is key. Always be yourself. I don't know. I'm finding in life, I pay attention to a lot of things. I see a lot of things, and I'm like, at the end of the day, it just pays to be yourself. It does. Not trying to be somebody else, not trying to do, oh, let me code switch and just be yourself. It'll pay off. I see it. Tabitha Brown was herself, paid off. Just be you and it will pay off. As far as where to find me, I have a website, www.nicoledvick.com. That's where you can buy my books. You can see episodes of my podcast. You can see me be guests on other people's podcasts. All sorts of things are on my website. I'm on LinkedIn under Dr. Nicole D. Vick. I'm on Instagram under Dr. Victorious. And I think that's it. I think that's everything.
Well, before I close, I want to say to our audience, for those of you that are watching on all of our channels, if you have not yet subscribed to our YouTube channel, please subscribe and enable all notifications. You'll be able to get all the shows live, as well as go back and watch all of the previous content where you can get all of the lessons from each and every last one of our guests that have been on the show. What I'm going to say to you, Dr. Nicole, is I am so honored that you have blessed us with your presence because truly, as you say, public health is definitely a main thing that I think we all need to be thinking about right about now. And you definitely shed an enormous amount of light on that. And I hope that we can have you back again on the show.
Absolutely.
And I have a closing monologue that I want to have that I have for our audience as well as for you, and that is Dr. Nicole D. Vick reminds us that leadership is not about titles; it is about service. It is about showing up for your communities that have been overlooked, unheard, and underserved. It is about using your voice, your platform, and your purpose to create pathways for others. Her work in public health, her writing, her podcasting, and her advocacy all speak to a life dedicated to transformation. But perhaps most powerful is the legacy she carries, the legacy of Tommy Simpkins and Nathan Neal. Their strength lives in her, their wisdom moves through her, and their love fuels the work she continues to do for our people. Tonight, we honor her journey, we honor her impact, and we honor the truth that when one of us rises, we all rise. This has been America in Black and White. Good night and stay empowered. Thank you again, Dr. Nicole. We'll see you again. Thank you, everybody, for joining us tonight. And please join us tomorrow night as I will be doing a special solo show tomorrow, one that will catch us up on all of this craziness and this madness and this chaos that is transpiring at this point. We will see you guys tomorrow night at 6 p.m. Eastern Standard Time. You all have a great night. And this is Charles.